The fluorescent lights of St. Joseph's Hospital emergency room cast a harsh, clinical glow, draining the world of warmth. Emily Harper sat stiffly in a hard plastic chair, her hands clasped tightly in her lap, fighting the urge to flee and pretend everything was fine. At 27, Emily was a quiet bookstore clerk, more at ease among neatly arranged novels than in crowded rooms. She found solace in the orderly world of bookshelves and whispered customer requests. But today, a painful issue had upended her tidy world, too urgent to ignore. She'd waited for days, hoping it would resolve itself. But when it worsened, her friend Sarah drove her to the ER, threatening to call 911 if she refused. A nurse with kind eyes and gray-streaked hair called out, "Emily Harper." Emily followed her down a sterile hallway, her cheeks already flushed with dread. How do you discuss something so private with strangers? How do you hold on to dignity when your body betrays you? "Room 4, the nurse said softly. "Dr. Carter, we'll see you soon. Try to relax, dear. We've seen it all here." Emily nodded, her stomach knotted with nerves. She'd barely settled onto the examination table's crinkly paper, now in a flimsy hospital gown, when a gentle knock came. "Ms. Harper, I'm Dr. Carter." Emily looked up to see a man in his late 20s, with steady hazel eyes and a warm, disarming smile. His presence was grounding, his movements calm and deliberate, his voice carrying quiet sincerity. "I hear you're having some discomfort," he said, pulling a stool beside the table instead of standing over her. "Can you tell me what's going on?" His gentle, direct tone, and the way he met her eyes without pressing made it easier for Emily to speak. She haltingly shared her symptoms, and Dr. Carter listened without judgment, asking thoughtful questions and nodding. "What you're experiencing is more common than you think," he said, his voice reassuring. "It's a treatable infection, nothing you caused, and nothing to be embarrassed about." The exam was quick and professional, made bearable by Dr. Carter's clear explanations of each step. "We'll start you on antibiotics," he said, washing his hands at the sink. "You should feel better in a couple of days and be fully recovered in a week. Follow up with your primary doctor in 5 days, but come back sooner if anything worries you." As he handed her the prescription, their fingers brushed, and Emily felt a surprising warmth, a spark she hadn't expected. "Dr. Carter," she said as he turned to leave, "thank you for making this less awful." He smiled, warm and genuine. "That's why I'm here, Emily. Call me James. Take care, and don't hesitate to reach out if you need anything." A week later, Emily returned for her follow-up. The infection had cleared, just as James predicted, but she hoped to see him again. Instead, Dr. Ellis, a brisk woman in her 60s, confirmed her recovery. "Dr. Carter asked me to say he's glad you're doing better," she said, updating Emily's chart. "He doesn't usually follow up like that, but he seemed concerned about you." Emily left with a mix of relief and quiet longing. She was healthy, but that brief connection with James felt like a missed chance. 2 months later, Emily was back in her element, arranging new releases at the bookstore. She'd thought of James occasionally, especially when passing the hospital, but she'd tucked the memory away as a small, kind moment. Then, on a quiet Thursday afternoon, while restocking the health and wellness section, a familiar voice broke her focus. "Excuse me, could you help me find something on public health programs?" Emily turned to see James Carter, out of his white coat, in a flannel shirt and jeans, looking both more approachable and strikingly handsome. "Dr. Carter," she said, her heart lifting. "James, please," he corrected, his smile sparking recognition. "And you're Emily, from the ER, right?" She nodded, touched that he remembered her name. "What do you need on public health?" James explained he was researching community outreach to bring medical care to low-income neighborhoods. Emily, intrigued, guided him to the right section, pulling books and suggesting databases. Their conversation flowed effortlessly, shifting from research to favorite novels, travel stories, and quiet ambitions. "I should let you get back to work," James said after nearly an hour. Though he lingered, Emily, feeling a rare surge of boldness, spoke up. "My shift ends in 15 minutes. There's a great coffee shop nearby if you want to keep talking." His grin was all the answer she needed. Over coffee, James shared that he'd chosen emergency medicine to help people at their most vulnerable, inspired by his rural hometown's lack of healthcare access. Emily opened up about her love for books, how she saw bookstores as sanctuaries where anyone could find answers or escape. "You know," James said, leaning forward, "our jobs aren't so different. We both help people who come to us feeling lost or scared." Coffee stretched into dinner, then a stroll through the city's botanical gardens. By the time James walked Emily to her car, they'd uncovered shared passions and an easy chemistry. "I'd like to see you again," he said as she unlocked her door. "Not as a patient, but as someone I really want to know better." Emily smiled, her heart racing. "I'd like that, too." 5 months later, Emily stood in St. Joseph's Hospital. Not as a patient, but as a guest at the launch of a community health outreach program James had spearheaded. The initiative, born from his research, now served underserved neighborhoods. Across the city, Emily watched him address the crowd, his passion for accessible care shining through. She'd been by his side through late-night planning, grant proposals, and moments of doubt, cheering him on as the project came to life. After the event, James found her in the crowd, taking her hand. "So, how's it feel to be dating a guy who's technically a big shot now?" he teased, referring to the grants funding the program. Emily laughed. "I fell for the doctor, not the headlines." He grinned, pulling her close. "Good, because I fell for the bookstore clerk who helped me find what I didn't know I needed." That night, in Emily's cozy apartment, surrounded by books and medical journals, James shared something deeper. "That day you came to the ER, you were so nervous but so strong. You faced something scary because you had to. That changed how I see my patients." Emily leaned against him, reflecting on their unlikely journey. "You know what I learned? Sometimes the moments that scare us most lead us to the people who change everything." In the quiet of their shared space, Emily realized that life's hardest moments, those raw, vulnerable ones, could be the very things that open doors to connection, kindness, and love. Sometimes, the things we fear most guide us home. If you enjoyed this story, don't forget to like, share, and subscribe. 2 stories that stay for more heartfelt tales. Hit the bell icon to stay updated.